Senate Bill 671, a bill relating to treatment of a patient for Lyme disease.
The senior senator from Loudoun, Senator Black.
Thank you, Mr. President. I move passage of the bill and speaking to the bill.
Senator has the floor.
Ladies and gentlemen, as many of you know, we have a tremendous problem with Lyme disease throughout the state, particularly in Northern Virginia. I would say probably Loudoun County is the epicenter of it, but I know that Fairfax County has a considerable amount, Fauquier, and it exists all throughout the state. It's an issue that has been struggled with by medical professionals over the years, and there is a standard routine that is followed if you have a tick and if you've got a typical bullseye rash that makes it rather easy to diagnose. There is typically a short-term period of administration of antibiotics, which in most cases will knock it out. However, there are cases in which it is not knocked out, and there are also a very, very extraordinary number of cases where there are false negative tests for Lyme disease, and those tests come back and the individual is told, well, you don't have Lyme disease, everything is fine. They go back and they continue to have symptoms if they do have the Lyme disease. And many times they feel like, okay, I've already taken care of it, so it must be something else. And the Lyme disease progresses and progresses and progresses. Other times they actually do go back and they ask for medical advice, and the practitioner very often says, look, you know, we tested it and you don't have it. Because of this, within areas that really are plagued by Lyme disease, you have developed a number of physicians who have dealt with this in the best way that they can, and they do it with a large and more lengthy dose of antibiotic. This typically is very successful, and it does work. However, the problem that we have is that there is some question about whether the Board of Medicine will accept that as the typical treatment. And what this bill does essentially is that it says that if a physician follows the instructions of the National Guideline Clearinghouse, which is an initiative of the U.S. Department of Health and Human Services in partnership with the AMA and the American Association of Health Plans, if they follow those guidelines, that they will not be subject to discipline for that particular action. Now, if they do some other things, I mean, obviously they may do those things and they may do some other things. Those things are subject to discipline by the Board of Medicine. I think while, you know, this is the only issue since 1998 when I joined the legislature, it is the only issue where I have gotten involved in any type of a medical practice. Interestingly, I asked the lobbyist for the Virginia Medical Association just yesterday. I said, where do you all stand on this? They said, we are monitoring it. They said, we're not lobbying against it. We're not lobbying for it. We're monitoring it. So just by way of background, I believe this is a very, very essential thing, because what we have is increasingly we have doctors who are shying away from from treating Lyme disease. They don't want these things because if they treat them according to the standard protocol, often it's not successful, and they just would rather not have anything to do with it. Now, last year there was a young fellow, and his name is Sebastian. Sebastian Karza. Very, very healthy young fellow. That's the picture of him. I gather he's probably about 2 years old in that photo. And Sebastian was bitten by 3 ticks. He showed the typical standard bullseye indications that he had been hit by Lyme disease. He went in, he was given a standard treatment, and sent home. Afterwards, he continued to experience the problems. He was taken back. The physician said, "Look, we've already taken care of this. There is no problem. There's no problem." This went on, and a year following the time of the tick bites, the child died of a heart seizure, and upon an autopsy, the pathology report included pictures that depicted the Lyme disease within his heart and his brain, and showed clear signs of persistent infection. Lyme disease is this way. Lyme disease can be almost a flu-like disease, but if it becomes entrenched, it becomes a disease that begins to devour the organs, and it becomes very, very entrenched. For that reason, I ask that you pass this bill, which will allow physicians to use this higher dosage of antibiotics if they feel that it is appropriate, and those guidelines are within the National Guideline Clearinghouse, which is, again, part of the U.S. Department of Health and Human Services, or rather acts in conjunction with them and in partnership with the AMA. I think you have the assurance that these are not off-the-wall procedures, but I think we have got to do something. In Northern Virginia, and I will tell you, in Loudoun County, there are areas that are plagued by this. And so I would just ask that you thoughtfully consider supporting this bill. And again, I urge passage.
Thank you, Senator. The junior senator from Henrico, Senator Donovan.
Thank you, Mr. President. Speak to the bill.
Senator has the floor.
So I would actually like to speak against this bill, but I would like to start by expressing my deep concern for people who suffer with Lyme disease. And I think I can echo all of our desire that we will find an appropriate treatment and cure for this illness. This bill does not accomplish that. So in medicine, one of the most important things that we do is that we critically and clinically discern a way to best help a patient and solve a problem, as opposed to responding to the emotion in the situation. And Lyme disease is very emotional because we do not yet have the right treatment. But this body needs to be very careful in the decisions that it makes to not allow that emotion for you to overstep good legislation. The Board of Medicine is commissioned to review standards of care, all clinical care. If one of your constituents has a complaint, like perhaps their child was not appropriately treated for Lyme's, they should place that complaint to the Board of Medicine and let a body of medical experts review that data. They're much more capable than we are of reviewing the clinical data and determining if appropriate care were given. We cannot pick and choose which standards of care we lock in and exclude from their discernment process. This is really important. If we pick this, what else are you going to pick? We have given the Board of Medicine the power to make these decisions and determine who is practicing within good clinical standards. Let me be further clear. In the 10 years that we have been tracking Lyme disease complaints to the Board of Medicine, there has been only one case heard. And the care of the patient's Lyme was considered along with many other things, and that doctor was reprimanded and responded, and everything was taken care of. This is not a problem at the Board of Medicine. The Board of Medicine is not intimidating doctors about what clinical management they can use. This is a bad bill. You cannot legislate what your clinical boards are doing to determine safety for your constituents in the Commonwealth, and I urge you strongly to vote against this bill.
Thank you, Senator. The senator from Southern Fairfax County, Senator Barker.
Thank you, Mr. President. Speaking to the bill.
Senator has the floor.
Mr. President, I rise also to speak in opposition to this bill and join with the junior senator from Henrico in urging a vote against this particular bill. We've established processes here to try to provide protection for the public and have a Board of Medicine that is responsible for handling these cases. And if there's a case where there's questions of judgment, questions of practice, questions about whether someone acted properly in terms of providing treatment to a patient or individual, that is the body that is charged with making that decision. They should not be shackled in terms of their ability to be able to get the information necessary to make determinations as to whether appropriate care was provided, and then to make decisions as to how to handle that if the care was provided inappropriately. As the junior senator from Henrico said, in many instances, even if something was done improperly, it's not necessarily means that someone loses their license or has their license suspended. You can be reprimanded, be handled in a way to try to prevent that from happening in the future. I think it would have an extraordinarily negative effect, a chilling effect to a certain extent, to be able to say you can't do a disciplinary proceeding. It doesn't mean that necessarily the treatment that might be provided in a particular case might not be an appropriate treatment for certain individuals with certain diseases, but it may not be appropriate for that patient. So if you're relying solely on whether there's a treatment that's listed in the clearinghouse guidelines that are referenced in the bill, it may very well be an appropriate treatment for certain individuals in certain situations, but it may not be appropriate for that individual treatment, but yet this bill would have the effect of probably preventing them from being able to initiate a disciplinary proceeding to determine whether appropriate care was provided or not and how that should be handled. So I think it is not our job to be able to accept the responsibility of being the Board of Medicine, but to be able to allow them to do their job and be able to handle things. And I don't think that there's evidence that there have been significant problems in them administering the code there. Thank you very much, Mr. President.
Thank you, Senator. The senator from Arlington, Senator Favola.
Thank you, Mr. President. I asked the senior senator from Loudoun if he would rise for a question.
Would the senior senator from Loudoun yield for a question?
I do.
Thank you.
Senator.
Well, could the senior senator from Loudoun tell me with some accuracy if the National Clearinghouse Guidelines include all of the possible standards of care that could be examined or could be appropriate regarding the treatment of Lyme disease?
The senior senator from Loudoun.
Mr. President, I would respond to the gentle lady that the only particular guideline that I know is this particular one. I would imagine that their guidelines also include the standard, which is a very rapid course of treatment, which I would say in probably 90% of cases or more is appropriate and is workable, and it's used even by those doctors who do the more in-depth treatments. They don't just automatically do that. They do that when they have somebody who has a more intractable situation.
Mr. President, I ask would the senator yield for a further question?
Senator, yield.
I do yield.
Question. He yields, Senator.
When I read your bill, the implication is that if you're not following a guideline in the National Clearinghouse of Guidelines, if you're following another standard of care, one could conclude that perhaps you are not practicing medicine properly. would the senator acknowledge that that could be a possible interpretation of this?
The senior senator from Loudoun.
Mr. President, I would say no. I would say that it simply says that if you follow this particular guideline, that provides you insulation from varying, but it's not, obviously there are a tremendous array of medical procedures of all sorts, and those would continue to come under the purview of the board.
Mr. President, speaking to the motion,
The senator has the floor.
I would ask that the ladies and gentlemen of the Senate defeat this bill. I have two reasons for asking you to do that. A group of physicians actually met with me in my office shortly after I was reviewing my docket for today, and we talked about this bill, and I asked them point blank if they checked the National Clearinghouse guidelines on standards of care before they administered treatment. And they asked me for what, and I suggested this Lyme disease. And the doctors told me that they did not consult with this clearinghouse. In fact, there were always multiple standards of care that are available to them. Their professional associations have standards of care. There's the Infectious Diseases of America that has standards of care. There's an international Lyme Disease Society that has standards of care. So they have several places they can go to for consultation on what would be considered an appropriate practice protocol. And they don't, to the person, and there were 5 of them in my office, they don't go to the National Clearinghouse. So it gave me pause to think that I, as a lawmaker, or that we as lawmakers, would second guess how a physician would determine what care to provide to a patient. And I certainly don't think we are qualified to be telling this Board of Medicine when and how they should be disciplining a physician. So for those reasons, I ask that the body please defeat this bill. Thank you.
Thank you, Senator. The senator from Spotsylvania, Senator Reeves.
Well, thank you, Mr. President. I appreciate the opportunity to speak to the bill.
Senator has the floor.
Ladies and gentlemen of this body, I think this is a good bill, and I'm going to tell you why. Because I can speak from personal experience, and I'm going to share a personal story. And many of you remember when the senator from Norfolk was about to measure me for a coffin on the back couch last year, where I was running 102 temperature because of my Lyme's disease. I am that case in point that the senior senator from Loudoun talked about. I went through the process. I met with the infectious disease doctors. They diagnosed me with chronic fatigue syndrome, gave me what was then, I think, 2 or 3 weeks of doxycycline, and sent me home packing. I had no remedy, none. So I had to start going outside the standards, traditions of medicine to find a doctor that was a Lyme's doctor that understood what I was going through. Lyme, thank you. I didn't find him, but up in D.C. My doctor went through this very same issue that the senior senator from Loudoun is trying to prevent. He was one of the chief doctors when HIV was starting to run rampant, and they were talking about doing cocktails and all those things and how to do that. My doctor will tell you, he was part of that group of doctors that was very aggressive to try to find a cure for HIV. And within that community, that medical community, there was a lot of back and forth in how to do it. My doctor will tell you, you will not die because of HIV today. You might die with it, but because of those advancements in medicine and the way that they practice that medicine, we are there with Lyme disease, right now. My doctor faced that in North Carolina. He moved to Washington, D.C. I didn't have to do the IV antibiotics, but it's very close to doing that. Lyme's is a nasty, nasty, nasty disease, and I know there are some members in this body who've had some of their kids who they've caught it early and they haven't had to deal with it. But what happens is this: these doctors start prescribing multiple courses of antibiotics. There are some in that community in the infectious disease realm that think that is not standard protocol and will make that complaint. This is a very narrowly defined bill to make sure that those doctors who practice Lyme can continue to do that without retribution. I know we have a doctor, and the fine doctor spoke to, from her standpoint. I'm talking to this body as somebody who has had to go through that. I still go on a course of antibiotics once a week for each month for 1 week to keep them at bay. But for me, Lyme's affects everyone differently. For me, it affected my adrenal gland. The body's supposed to produce 20 to 30 milligrams of cortisol a day. That's the thing to get you up to flee or fight. Lyme's affected me. I was producing 2. I couldn't even wake up. If you don't produce any, you have Addison's disease. That's what President Kennedy had. It's a very serious disease that needs serious consideration. I would ask this body to pass the bill.
Thank you, Senator. The senator from Northern Fairfax County, Senator Howe.
Thank you, Mr. President. Speaking to the bill.
Senator has the floor.
Actually, in listening to the senator from Spotsylvania, I almost turned off my light because there's nothing I can say that's as eloquent as what he said. But I also urge the passage of this bill. The senior senator from Loudoun did a wonderful job of describing the bill. What I want to do is describe some of my constituents, because Reston and Vienna and my part of the state, like Loudoun, is the center of a pandemic and a plague. I've had people come and speak to me with Lyme. They have lost their jobs. They are in constant pain. They are desperate, absolutely desperate. And there are children with it who can't participate in sports. They're having trouble keeping up in school. This is a very serious disease, and it's spreading across the Commonwealth. We know that that medicine is slow to adopt new protocols, and there's good reason for that. But sometimes you're in a situation where you need to go a little bit further in order to help people. I don't see any reason why doctors who are trying to prescribe more antibiotics or antibiotics for a longer term should be sanctioned. It makes absolutely no sense to me, and I certainly hope we'll support this bill. Thank you.
Thank you, Senator. The junior senator from Henrico, Senator Donovan.
Thank you, Mr. President. Speak to the bill.
Senator has the floor.
I just want to emphasize again how important it is to separate your empathy and emotion for the people who have this disease from a means of improving their care. This bill will not give you more access to physicians that provide long-term IV antibiotic therapy. It will not help find a cure or a treatment for Lyme disease any more quickly. Your Board of Medicine is doing good work. It is removing unsafe doctors. Again, one case in the last 10 years even involved this protocol, and that was but one of many things for which that doctor was sanctioned. The Board of Medicine is not using this as an intimidation factor in any way. So you have to be very careful here. I hope that we'll be entertaining some bills that actually help patients with Lyme disease. This does not do that, and I urge you to vote against this bill.
Thank you, Senator. The question is, will Senate Bill 671 pass? All in favor of the motion will record their votes aye. Those opposed, no. Are the senators ready to vote? Have all the senators voted? If any senators desire to change their votes, the clerk will close the roll.
Ayes 24, noes 15.
Ayes 24, noes 15. The bill passed.